Welcome to Module 6. Module 6 will be looking at the terms associated with cardiology and also cardiovascular medicine. So that's looking at the heart and the vessels. Cardiology is the study of the heart. Ology is our suffix meaning study of, and cardi is heart. You may also hear the term cardiovascular medicine, where you have cardi being the heart and vascular relating to the vessels, the blood vessels. In this section we're going to look at lots of root terms, we're going to look at many common conditions, suffixes, and of course lots of words. To help understand many terms associated with the heart, it is useful to understand how the blood flows through the heart. So let's have a look at this diagram. On the left hand side you will see the term the right atrium. The blood from the vena cava, which is the name of the big vein on the right hand side of the body, enters the right atrium. From the right atrium the blood is then pumped down into the right ventricle. On the right side of the heart the blood is holding deoxygenated blood. This blood is then pumped to the lungs via the pulmonary artery, where the carbon dioxide in the blood is dropped off and a fresh supply of oxygen is picked up. From the lungs, the blood returns to the heart via the pulmonary vein and enters the left atrium. The left atrium then pumps the blood down into the left ventricle, which is a big, strong ventricle, very strong muscular wall. And when the ventricles contract, the blood from the left ventricle is pushed up out of the aorta and to the body and to the head, supplying the body with that nice fresh supply of oxygen. Let's look at the root terms associated with the heart and the vessels. So our first one, artery with an I, is artery with a Y. Our word example, arteriosclerosis. Let's break it down. Well, sclerosis means hardening, so arteriosclerosis will be hardening of the artery. Phleb or ven is vein. Phlebitis. Itis means inflammation of, so let's put our break in. So phlebitis therefore would be inflammation of the vein. I've had this when I got bitten by my cat and on my wrist. It bit me here, we were playing, and I felt quite poorly actually, and I could see my vein becoming more and more inflamed and the redness literally creeping up my arm. Went to the doctors, they sorted me out. Next term, heme or hemat is blood. So we can have hematology. Well, ology is study of, and hemat is blood, so let's put the break in, study of the blood. Angi or angio is a vessel. Now commonly you may think of it as a blood vessel, but it could be any vessel in the body. Let's have an example. I may be sent for a coronary angiogram. Well, the term coronary relates to the heart vessels, as in the coronary arteries. So the term coronary you can think of as heart. So coronary angiogram, let's break it down. Angiogram. Gram is a tracing, angi is a vessel, so it's a coronary angiogram is a tracing of the vessels of the heart, or tracing of a coronary vessel. Thromb is a thrombus, and a thrombus is another term for a stationary blood clot. So you may have heard the term a thrombosis, or a DVT is an abbreviated form for a deep vein thrombosis. So thrombosis, let's break it down. Osis is our ending, meaning condition or disorder. So we have a condition or disorder of a stationary blood clot. It's a condition of having a blood clot. Thromboembolism, we had the term embolism earlier. Embolism meant a travelling clot. So if I have a thromboembolism, I have a stationary clot, the thrombo part, which has suddenly gone on the move. So it becomes a thromboembolism. A stationary clot becomes a travelling one. Some more root terms. Cardi or cardio means heart. Our word example, cardiomegaly. I said before I like this word, I still like it now. Cardiomegaly, let's break it down. Well, megaly means enlarged and cardi is heart. So therefore, it's an enlarged heart. My or myo is muscle. Cardiomyopathy. Let's break it down. Cardio, break, my or myo, break, pathy. Pathy means disease, so we have disease of the heart muscle, or disease of the muscles of the heart. Athero. Athero means atheroma, and atheroma is a Greek word which actually means porridge. We're going to think of it as fat in the artery. If you actually squeezed an artery full of fat, it looks, when it comes out, it looks like porridge. Hence the term atheroma. Let's have a word example. Atherosclerosis. Well, we know now that sclerosis means hardening. So therefore, atherosclerosis is hardening of fat in the arteries. And this is what can build up in your arteries and cause potential sites for blockages. Another term for these atherosclerotic areas are called plaques. Lipid or lipo is fat. Hyperlipidemia. Let's break this down. We've got two breaks here. Hyper, break, lipid, break, emia. Emia is the blood condition, so there's something wrong with the blood. Lipid is fat, and hyper is too much. So we have here a blood condition of excess fat. This excess fat may lay itself down in your vessels and cause atherosclerosis, the term above. Atrium or atria, well, they're the terms for the upper heart chambers. And atria or atrium actually means a room, it's a space. There's the term atrial fibrillation. Well, we can break down atrial. Atrial means relating to the atrium, so one of the heart chambers. Atrial fibrillation is when the heart chambers at the top, the atria, they quiver. So rather than pumping nicely like this, pumping the blood down into those ventricles and doing their job properly, what happens in atrial fibrillation is this. Funky chicken. So the atrial fibrillation just quiver away like that, and so the blood in the atria doesn't move particularly well, and consequently patients with atrial fibrillation are more prone to blood clots. And these types of patients would be put on medicines like warfarin, which thin the blood, so help prevent these clots. Ventricles, well, they're the other chambers in the heart, the big ones at the bottom, they're the lower chambers, and ventricle is also another term meaning room. So you've got lots of rooms in your heart, you have 4 in all, 2 at the top, 2 at the bottom. So you could have ventricular fibrillation. Ventricular would break down as relating to the ventricles. If you have quivering of ventricles, well, that is pretty serious. Your ventricles are quivering and not pushing the blood out into the body. Septo means septum, a dividing wall. You have a septum in your nose, dividing the left side from the right side. In your heart, you have a septum dividing the left side from the right side, keeping the oxygenated blood and the deoxygenated blood separate. Some people may have what's called a ventricular septal defect, or a VSD is the abbreviated form. A ventricular septal defect would mean a hole in the heart, or a defect between the ventricles. Atheroma. Can you remember what it means? It means porridge or fat in the arteries. On the diagram you can see how the fat lays down on the walls of the artery, narrowing that artery, and also it will make it stiffer and harder. Atheroma can also be termed plaques. Let's look at a word. Atherosclerosis. So that would be athero break sclerosis. Sclerosis means hardening, so it's hardening of the fat in the artery. So let's pop that term down. Sclerosis means hard or hardening. Another term would be arteriosclerosis. So we know that sclerosis is hardening, so this would be hardening of the arteries. A similar word is stenosis, with an N, stenosis. If you think N for narrowing, so you could have arteriostenosis, that would be narrowing of an artery. Narrowing of arteries, hardening of arteries, the build-up of these plaques and atheroma in the arteries can all lead to something called ischemic heart disease. Let's look at that next. Ischemic heart disease is very common. It's known as IHD. And what ischemia actually means is insufficient or reduced blood supply. So, ischemic heart disease is heart disease caused by an insufficient blood supply. A common example of ischemic heart disease is angina. Angina is a suffocating chest pain, and it can be triggered by exercise, tiredness, anger or stress. And angina is a type of myocardial ischemia. So let's break that down. Well, ischemia we know means insufficient blood supply. AL is relating to, cardi is the heart, my is muscle. So this means insufficient blood supply relating to the heart muscle. Two abbreviations associated with ischemic heart disease include CHD, which means coronary heart disease, relating to problems with the coronary arteries within the heart, and CAD, coronary artery disease. They're the same thing, really. If you have coronary heart disease and your coronary arteries are all furred up and clogged up with atheroma and causing a lot of ischemic problems and angina, it's possible you may be put forward to have what's called a CABG, a CABG, nicknamed a CABG. And this is a coronary artery bypass graft. It's an operation replacing the clogged up coronary arteries with an artery or vein graft taken from the leg or the arm. In order to diagnose the amount of coronary heart disease or clogged up arteries, a coronary angiogram may be performed. Let's have a look at that. Here we have a diagram of the heart showing us the process of a coronary angiogram or coronary angiography. Very interchangeable, these terms, ending in gram and graphy. You can see on the diagram the tip of a catheter that has been pushed into the right coronary artery. The catheter is delivered there via the aorta, so your main blood vessel, having been originally inserted down at the top of your thigh in a groin vessel. Dye is then injected into the artery and the vessels clearly show up on X-ray. The X-ray will show up any narrowing of the vessels and atheroma. Let's break the word down. Coronary angiography. So graphy is our X-ray, angi is our vessels, coronary relates to heart, so we have heart vessel X-ray or heart vessel picture. A condition linked with ischemic heart disease is something called a myocardial infarction. And this is a big term for a heart attack. And a heart attack is when part of the heart muscle actually dies. Let's have a look at this in more detail. If we look at the diagram, you can see the diagram of the heart where the atheroma is. If you look at the enlarged section of the vessel, you can see how the atheroma will narrow the artery, and if a blood clot comes along, it could get wedged and stop the flow of blood. So this blocking is called occlusion. So you would have occlusion of a coronary artery. Consequently, the blood is not getting through, and so tissue just beyond that, which would be supplied by that part of the vessel, is going to be damaged due to a lack of oxygen. And you can see on the picture of the heart, we have a little sort of grey and dark blob, implying that that part of the tissue of the heart has died. So myocardial infarction literally means death relating to heart muscle tissue. When a person has a heart attack, there are different levels of severity. A person may have a small heart attack and they may not even notice any pain. They may not realise they've had a heart attack. And then at the other extreme, there is a heart attack that could be so large that so much of the heart muscle is damaged that the patient could die. Let's look at some more suffixes. In the respiratory system, we had the suffix "nia", meaning breathing. So dyspnea means difficulty breathing. In relation to the heart, a person may have dyspnea when they have various heart conditions. What can happen is a patient can get pulmonary edema, so fluid on the lungs, and as a result of that, they can't breathe. But the reason they get the fluid on the lungs is because the heart is failing. It's not doing its job properly. It doesn't mean it's not working. If you have heart failure, it just means it's not working particularly well. So a patient with heart problems can get dyspnea. Aemia is blood condition. Hyperkalemia. Well, aemia means a blood condition. The AL relating to, the K is potassium, and hyper is increased or excess. A patient who has had a heart attack may have hyperkalemia. It's a blood condition of excess potassium. A new term, lysis or lytic, is a suffix meaning breakdown. A person may require thrombolysis. Lysis, we know, is breakdown, so thromb is the clot, so thrombolysis is breaking down a clot. Another term for this breaking down of a clot is a clot buster. So a person who has had a heart attack may be given a thrombolytic drug which will break down a blood clot. Another term where lysis or lytic is used is the term hemolytic anemia. Well, this would be anemia caused by the breakdown of blood cells, actually breaking down red blood cells, and this will cause anemia. And just to explain exactly what anemia is, can't really break this word down particularly easily. What it means is a lack of blood, meaning a reduced number of red blood cells, RBC is the abbreviation for red blood cells, or an abnormality of the red blood cells. And classically, you think of patients with anemia as having a low hemoglobin count, and the hemoglobin is the part of the red blood cell which carries the oxygen. Let's look at some general terms. Oedema means fluid. Our example previously was pulmonary oedema, which would be fluid on the lungs. But one of the things that occurs with right-sided heart failure is a patient may get oedematous ankles. So they get swollen ankles because fluid gets pulled down by gravity and collects around the ankles. Oedematous ankles. Effusion means fluid. So pericardial effusion, let's work out what this means. Well, effusion we know means fluid. AL means relating to. Cardi is heart, and peri is the prefix meaning around. So we have fluid around the heart. And I have a nice picture here. This is actually what's called an echo or an echocardiogram. It is an ultrasound of the heart. You can see the heart chambers have been labelled here. We have LA for your left atrium, RA for your right atrium, LV for your left ventricle, and RV for your right ventricle. The pericardium is the outer wall of the heart, i.e. it is around the heart. So pericardial effusion is a fluid within the pericardium, or fluid around the heart. Our next term, sclerosis, means hardening. Well, we had arteriosclerosis before, meaning hardening of an artery. I've thrown this one in, tympanosclerosis. Tympan related to your eardrum. So tympanosclerosis would be hardening of the eardrum. Stenosis is narrowing. Arteriostenosis, narrowing of an artery. Ischemia is insufficient blood supply. Myocardial ischemia would be an insufficient blood supply to the heart muscle. A classic example of myocardial ischemia is angina. Infarct means death of tissue. So an infarct can occur anywhere in the body where there's death of tissue. The one we're thinking about in the heart is a myocardial infarction. That's death of heart muscle tissue, otherwise known as a heart attack. Occlusion is blockage, coronary artery occlusion, so blocking of a coronary artery. Fibrillation is quivering, and we had atrial fibrillation, where the top chambers of the heart, the atria, quiver away, not pumping the blood properly down into the ventricles. And atheroma means fat in an artery. Atherosclerosis, hardening of the fat in the artery. Next, we are going to look at the heartbeat. The heartbeat has two phases. The first phase is known as diastole, when the heart fills with blood, and the second phase is known as systole, when the blood is pumped out to the body. Let's have a look at the diagram on the left-hand side. The atria and the ventricles work in sequence. So the atria will pump together, pushing the blood down into the ventricles, and then the ventricles in turn will pump to push them out to the body and the lungs. The heart is considered at its most relaxed phase during diastole, when the atria, which are quite weak-walled chambers, give a little extra push, contracting, and push the blood down into the ventricles. The ventricles are big, strong, muscular-walled chambers, and when these pump and contract, the pressure in the system is high and it pushes the blood out to the body. So those are the two phases of the heartbeat. The terms systole and diastole are used to describe various aspects relating to blood pressure and murmurs, which are abnormal heart sounds. So let's just remind ourselves what diastole means. Diastole relates to when the heart is at rest and the atria contract, and so the heart is filling with blood. The ventricles fill with blood. Systole is when the ventricles of the heart contract, so pumping the blood out to the body. And a murmur would be an abnormal heart sound. Let's have a look at some terms which use diastole. So a diastolic blood pressure. BP stands for blood pressure, So diastolic blood pressure is the blood pressure when the system is at its most relaxed. So the heart is at rest and the ventricles are filling. Whereas the systolic blood pressure is when the heart is working at its hardest, the ventricles are contracting and pushing the blood out. So consequently, from that information, you may realise that a systolic blood pressure is a bigger number because the pressure is greater in the system. The diastolic blood pressure is the smaller number because the system is at its most relaxed. We will talk about blood pressure in more detail shortly. A murmur, you may hear the term diastolic murmur. Well, this would be an abnormal heart sound heard when the heart is filling up with blood. Normally, the diastolic murmurs are quite gentle and soft, harder to hear, partly because when the atria contract, it's only a small little bit of pressure, pushing the blood into the ventricles, which are ready and waiting to fill up with blood. A systolic murmur is a murmur heard when the ventricles contract. A murmur is classified depending upon at what point during the heartbeat the abnormal sound is heard. Is it during diastole or is it during systole? With regards to murmurs, one way of confirming a murmur and seeing exactly what's going on is to use an echo. An echo is an echocardiogram, and this is an ultrasound of the heart. We looked at this picture earlier, showing us the chambers of the heart and the pericardial effusion, the fluid that had got into the pericardium around the heart. An echocardiogram would show up all the valves opening and closing, and you can also see blood flow through the heart. Very clever stuff. The test to look at the electrical activity of the heart, and therefore the rhythm of the heartbeat, is the ECG. This is called the electrocardiogram. It literally breaks down to mean a tracing of the electrical activity of the heart. And the diagram here, that is a tracing of your heart. One of the things an ECG will show is if you have a normal heartbeat, as in a normal rhythm. But if you do not have a normal rhythm, you may have arrhythmia. Arrhythmia, we can break it down. A at the front of a word means no. We have an extra R here, and then the term rhythm, which means rhythm. And ear is a condition, so I have a condition of no rhythm. And what it's talking about is the heartbeat has an abnormal or irregular pattern. It's an irregular heartbeat, lack of normal rhythm. An ECG will show up all sorts of things, from angina to a myocardial infarction. Let's look at another term. Asystole. Well, we can break this down. Asystole, A means no, and systole relates to when the ventricles contract. So if a patient is in asystole, the ventricles are not contracting. And that would show up as a flat line on the ECG. And in this situation, the medics would get out their defibrillator and put an electric shock through the heart to try and get it back into normal sinus rhythm, a normal regular heartbeat. Blood pressure or BP. An example of a blood pressure would be BP 140/85 mmHg. That stands for millimetres of mercury. The 140 relates to the systolic blood pressure and the 85 relates to the diastolic blood pressure. So let's remind ourselves about those terms. Blood pressure is the force of the blood pushing against the walls of the arteries. With each heartbeat, blood is pumped into the arteries. Blood pressure is at its highest when the ventricles of the heart contract, pumping the blood out to the body, and this is the systolic blood pressure. When the heart is at rest, between beats, the blood pressure falls. So this is when the weak atria actually contract, pushing the blood into the ventricles. And this is the diastolic blood pressure. A classic healthy example of a blood pressure would be 120/65. The bottom number is the diastolic blood pressure, and the top number is the systolic blood pressure. Now, some of you may take your own blood pressure, and I have a machine here. I put it on my arm. I'm going to take my blood pressure. All I have to do is press start once I turn it on. So let's see what it is. It's supposed to be relaxed, and off I go. The machine is pumping up the cuff around my arm. Ooh, mine's quite good. 122/74. Quite pleased with that. If someone has high blood pressure, it's known as hypertension. And let's look at the terms associated with hypertension. We have essential or primary hypertension. This is high blood pressure, but there's no underlying cause. There's no other disease actually causing the high blood pressure. If you broke the word down, hypertension, you could think increased tension, relating to increased tension in the blood vessels. A high blood pressure reading would be something like 160/100 millilitres of mercury. So the bottom number is the diastolic blood pressure, so when the atria contract and the ventricles fill with blood. And the top number, the systolic blood pressure, when the ventricles contract, pushing the blood out to the body. There is something called secondary hypertension. Now this is hypertension associated with another disease. So high blood pressure caused by another medical condition, for example, kidney disease or diabetes. If you have a high blood pressure, if you have hypertension, the doctors will want to treat it to try and keep it down. Keeping blood pressure at a healthy level helps slow the progress of chronic diseases. If a patient has hypertension and it is left unchecked and untreated, this persistent hypertension, so ongoing hypertension, can cause problems. And this slide shows us some of the conditions that can occur associated with high blood pressure. So you can have problems with the brain. You could have a cerebrovascular accident. That's the term meaning a stroke. You could have hypertensive encephalopathy, which is disease of the brain associated with high blood pressure. You can have damage to the blood vessels. In the eye, there are very small blood vessels, and at the back of the eye, called the retina, these tiny blood vessels could become damaged. So you could have hypertensive retinopathy. Pathy is disease, retin related to the retina, part of the back of the eye. Hypertension will give you a greater risk of a myocardial infarction or hypertensive cardiomyopathy, so disease of the heart muscle associated with hypertension, a type of heart failure. The kidneys can also be affected. Hypertensive nephropathy, so pathy is disease, nephro is kidney, so it's disease of the kidney associated with hypertension. Ongoing disease of the kidney is also known as chronic renal failure. And now it's time to break some words down. Our first word to break down, angiogram. Let's break it down. Gram and angio. What does it mean? Tracing of a vessel. Gram is tracing, and angio is vessel. Angioplasty. Let's break it down. Angio, break, plasty. Plasty means surgical repair. so it's surgical repair of a vessel. Cardiomyopathy. Let's break it down. Cardio, break, myo, break, pathy. Pathy is disease, so it's disease of the muscles of the heart or disease of the heart muscle. Hyperlipidemia. Let's break it down. Hyper, break, lipid, break, emia. Emia is a blood condition, so I have a blood condition of hyper, too much, lipid, fat. So too much fat in the blood, or a blood condition of excess fat. Endocarditis. Endo, break, card, break, itis. Itis is inflammation, card is heart, and endo, inside. So it'll be inflammation of the inside of the heart. Hypertrophy. Hyper, break, trophy. Trophy means nourishment or growth. Therefore, hypertrophy would mean increased nourishment or increased growth. But a better way to think of the term trophy is in relation to size. So hypertrophy would mean increased size or thickening. On our next slide, we are going to look at more detail at this suffix trophy. The suffix trophy, as we just mentioned, means nourishment or growth, but we want to think about it in terms of size. If you look at a normal cell compared to cells showing hypertrophy, in the diagram you can see that the cells showing hypertrophy are bigger. They're bigger in size. I think a good way to remember the term trophy is pigs eat out of a trough, so they're nourishing, so they're going to get bigger. Let's look at another example. Left ventricular hypertrophy, or LVH. So what's happening here is you have hypertrophy, increased size or thickening of the left ventricle of the heart. Another example, atrophy. Well, atrophy, A at the front of a word means no, trophy is our nourishment or growth, so if you have no nourishment, what's going to happen to the cells? Well, they're going to waste away. So if you're without nourishment, you get wasting, so it's the opposite to hypertrophy. There is another suffix which on the surface appears quite similar to the term trophy, and it's plasia. Plasia means formation or growth. In orthopaedics we mentioned the term dysplasia of the hip, so disordered formation of the hip. And if we look at the word hyperplasia, hyperplasia would mean increased formation or growth, and in this case this number of cells increases rather than the size of the cells. A classic example where this becomes very clear is in the term neoplasia or neoplasm. This would mean new growth or formation, and the term neoplasia or neoplasm would relate to new cells being formed associated with cancer. It's time to look at some more words to break down. Our first word on this list to break down, arteriography. Your break goes after the O. Graphy means X-ray or picture, so it's an X-ray of an artery. Phlebotomy. Well, the break goes after the B. Otomy is our suffix meaning incision, so it's an incision into a vein. Well, actually, it is an incision into a vein, but it's in order to take blood. So you have a phlebotomist, and a phlebotomist, let's break that down. Phleb is vein, otom relates to the incision, and ist is a specialist. So a phlebotomist is a specialist who takes blood, or a specialist who makes incisions into veins in order to take blood. Thrombolysis. Thrombolysis. Thromb was our clot, referring to a stationary clot. Lysis means breakdown. So thrombolysis would be breakdown of a clot, and it's often called a clot buster if you're talking about a thrombolytic drug that can break down clots. Hypertrophic cardiomyopathy. Yes, we can break this down. Let's have a look at it. Hypertrophic. The ick there is the relating to part. Troph we know is the nourishment or growth, or we're going to think about size. Hyper, increased. Cardiomyopathy, well, pathy is disease, my is muscle, cardi is heart. So if we put that all together, it is disease of the heart muscle relating to increased size. So for example, left ventricular hypertrophy would be a type of hypertrophic cardiomyopathy. And diastolic murmur. Well, it's hard to break this one down. We could take the ick off the end and say it's a murmur relating to diastole. Let's just give the meaning. So we know a murmur is an abnormal heart sound, and diastole, or diastolic, relates to when the heart relaxes. The atria contract and the ventricles fill with blood. So diastolic murmur, an abnormal heart sound when the heart relaxes. Some abbreviations. An ECG, electrocardiogram. This was the tracing of the heart, measuring the electrical activity of the heart. And one of the things that may show up on an ECG would be AF, atrial fibrillation, when the atrial chambers are quivering away rather than pumping properly. Another type of investigation would be an echocardiogram, which is an ultrasound of the heart. And this will show up all the chambers and the valves opening and closing, and can even show the blood flow through the heart. Very impressive. One of the things that could show up on an echocardiogram is LVF, a left ventricular failure. So the left ventricle isn't working properly. And a type of left ventricular failure is LVH, left ventricular hypertrophy, when you have increased size or thickening of the left ventricle, and this actually ends up inhibiting its function. Left ventricular hypertrophy can be associated with high blood pressure, hypertension. IHD, ischemic heart disease. Ischemic, that word meant insufficient blood supply. So ischemic heart disease is a type of heart disease caused by a lack of blood supply to the heart. A classic example is angina, when patients get suffocating chest pain because literally they do not have enough oxygen getting to the tissue of the heart. Types of ischemic heart disease include coronary heart disease. Our example earlier was when we had furred up arteries, coronary arteries with atheroma, fat in the arteries. Fat in the arteries will increase the risk of having a heart attack due to a blockage. And MI, a myocardial infarction, is the term for heart attack. An infarct or infarction means death of tissue, and myocardial relating to the muscle of the heart. So it's a heart attack, death of heart muscle tissue. And last on this list, CABG, C-A-B-G, coronary artery bypass graft. It's obviously not really a CABG, it actually just looks like it's spelt that way. It is in fact replacing the old furred up coronary arteries in the heart with veins from the leg or the arm, and that will be the graft. HF means heart failure. A patient may have left-sided heart failure or right-sided heart failure. We actually mentioned a term earlier, oedematous ankles, where fluid builds up around the ankles and they look all swollen and puffy. And this is associated with right-sided heart failure. It can be associated with other things as well, but classically it is one of the signs of right-sided heart failure. CCF, congestive cardiac failure. Well, what that is saying is that you've got problems on the left side and the right side. It's all congested, all bunged up, not working well at all. VSD or ASD. VSD stood for ventricular septal defect. So the dividing septum between the left and the right side of the heart has a defect. It has a hole in the heart. If it was an atrial septal defect, it'd be a hole between the atria at the top of the heart. DVT, deep vein thrombosis. Osis is our ending, meaning a condition or a disorder. So I have a condition of having a clot deep in my vein. Potentially what can happen with DVTs, deep vein thrombosis, is these stationary clots that can become mobile, and you can have a PE, a pulmonary embolism. So the embolism is the travelling clot, and pulmonary is telling us it has landed in the lungs. TIA, transient ischemic attack, or a mini stroke. A stroke affects the brain, but high blood pressure can be one of the reasons these things occur. A transient ischemic attack is an attack to the brain of insufficient blood supply. If you have an insufficient blood supply to the brain, then a few brain cells will get knocked out, and this would be described as a mini stroke. CVA is a cerebrovascular accident. This is a stroke. This is a bigger incident, and a patient may end up being paralysed from having a cerebrovascular accident, a stroke. CRF, chronic renal failure or ongoing kidney failure. So these terms here are associated with heart problems because of high blood pressure. And now it's time to recap some root terms. Let's just remind you of some of these root terms. Arterio was artery. An example would be arteriosclerosis, hardening of the artery. Arteriostenosis, narrowing of the artery. Arteriography, an X-ray of the artery. Next one, phleb or ven is vein. So I could have phlebitis, inflammation of the vein. Venous relates to the vein. A phlebogram, tracing of a vein. Heme or hemat is blood. I could have hemoptysis. Tussis was a suffix meaning cough. So hemoptysis was coughing up blood. Hematology, study of blood. Angie or angio is vessel. So I could have angioplasty, surgical repair of a vessel. Angiogram, tracing of a vessel. Thromb is a clot or a thrombus. So I could have a thrombosis, a disorder of having a clot. Lipid or lipo is fat. Hyperlipidemia was a blood condition of too much fat. Cardio is heart. My is muscle. So I could have cardiomyopathy, disease of the heart muscle. Athero related to atheroma, which was the porridge or fat in the arteries. So I could have atherosclerosis, hardening of fat in the arteries. The atrium or atria are the upper heart chambers, and people suffer with atrial fibrillation, quivering of the atria. Ventricles are the lower heart chambers, and you may have left ventricular hypertrophy, which would be increased size of the left ventricle. And lastly, septo relates to septum, the dividing wall. In relation to the heart, you could have a VSD, a ventricular septal defect, a hole in the heart. You may require a septoplasty, a surgical repair of the septum. And remember, septums are dividing walls and can be found in many places in the body. So I could have a septoplasty in my nose. It's time for In Your Head root terms. Here we have a list on the left-hand side. Have a look at it and try and match up the root term with the definition on the right-hand side. I've been a bit cheeky on this one and actually thrown in some root terms from other areas. So let's start off and have a look, and I'll click my magic button in a minute. Our first one, pulmo, means lung. Angio means vessel. Myo means muscle. Septo was the dividing wall, septum. Trache was your trachea, which is your windpipe. Thromb was a thrombus, a stationary clot. Tympan is your eardrum. There was another word for eardrum as well, my Ringo. And heme is blood, or hemat is also blood. And last, phleb is vein. Well, you've now finished Module 6. Do go back and have a look at anything you like, and on the left you will see where to go for your quizzes.